Thank you very much. And the gentleman from New York was talking about treating people rudely before. Let me try to be polite to the gentleman, the doctor here, and allow him to answer the question that was posed. I think you were saying something about the JAMA study, and what was that you were going to say, doctor?
I'm afraid that medical research isn't as free of politics as we wish it was. This is one paper. There are other papers that say quite the opposite. I thought that that paper was very interesting, and that the chief author was a medical student who was formerly an attorney who worked for NARAL. One of the authors, the other authors of that paper, Dr. Dre, is one of the largest abortion providers in the city of San Francisco. I would hardly find their findings unbiased.
Thank you. Let me ask further. Ms. Zink was relating her story, which was certainly moving, I think, to everybody in this room. She was talking about an unborn child that had, I would assume, a particularly rare condition. Would one of the doctors here like to at least tell us, is this something that's common in this particular case or something that's relatively rare?
Dr. Genesis of the corpus callosum?
Yes.
It's relatively rare, but it's not that rare. I see it not infrequently.
How one out of what are we talking here?
I'd have to go back and look at it. Maybe I'd have to go back and look. Maybe 0.5% or so.
So we're talking about 1 out of 200, if you mean
Perhaps.
0.5%. Okay.
Correct. Yes, sir.
Let's talk about the other 199, and maybe not all 199, but and let me go back to you, Dr. Levitina, if I can. You mentioned, I think, 1,200 abortions that
Yes, sir.
that you had performed. And I don't want to put you on the spot here, but most of those abortions, is it safe to say that had they not been terminated through an abortion, that these would have been normal, healthy babies ultimately in the majority of those cases? Is that accurate, would you say?
Yes, sir. That's typical with an abortion practice. It certainly was with mine. The number of abortions out of that 1,200 that I did for fetal anomalies were less than 5.
Less than 5. So we're talking about 1 out of 200 here. We're talking about the vast, out of the 1,200, what would you say would have typically been healthy babies?
The vast majority, over 99%, sir.
Okay. And so if we're looking at tragedies here, I mean, I think we have to look at the relative tragic situation that we're talking about. And again, I don't want to put you on the spot, doctor, but would you want to share? And if you don't want to, you don't have to. Was there something in particular that changed your view on this important topic?
I won't elaborate considerably. All I can say is, Ms. Zink, I do understand your pain. I have lost a child too. I know what that feels like, and I'm sorry. It was a time, as I said, that I was very pro-choice. This was a decision between a doctor, that patient, and nobody, including the baby's father, had anything to say about it. I was very dedicated in that business, and I did it for many years. Going through this, doing that procedure, didn't exactly help me sleep at night. And in 1986, I lost a daughter. And after you've lost a child, and then you go back to the hospital, maybe 2 weeks after her death when I went back to work, and I went into the medical center to do my first D&E abortion. And I reached in with that Sofer clamp, and I literally ripped out an arm or a leg. I got sick. When you do an abortion, you can't stop. You have to finish that abortion. If you don't get all the pieces, your patient's going to come back infected, bleeding, or worse. And I know it sounds strange to people, but I tell you it's sincere and true and firsthand. For the first time in my career, after over 1,200 abortions in private practice, much less the hundreds I did during my training, I really looked at that pile of goo on the side of the table that used to be somebody's son or daughter, and that was a very life-changing experience.
Thank you, Doctor. And Dr. Malloy, finally, before I run out of time, would you describe again, as far as the pain, what you said you see this every day. What kind of pain are we talking about? How do you know that there's pain there?
Well, we have to put IVs in babies, we put chest tubes in babies, we intubate babies, we do lots of things that are nowhere near dismemberment or stabbing them in the heart with potassium chloride. We do things that are probably 1/100th as painful as what he's describing. And they feel that, they wince, they cry, they move away from it, they try to push your hand away when you're putting an IV in. So I know they respond to those simple procedures that we perform, so I can just shudder to think what is happening when that kind of procedure is performed.
Thank you, Doctor.